Do you think it's morally right to perform this type of surgery? I was waiting for this question, it always comes up. Of course it is. The patients I deal with are trans women, so they start out with male anatomy, but they have a female gender identity. If you don't offer them appropriate support, counselling, and in the end surgery, we think about 1 in 5 of them commit suicide. Hello, my name's James Bellringer. I'm a gender surgeon, meaning I do operations for gender dysphoria, and I'm here to answer questions in the honesty box. How did you get into the work you do? I was trained as a urologist, which is a surgeon who deals with kidneys, bladders and genitalia. And when I was appointed to West Middlesex Hospital in West London with a session at Charing Cross Hospital where this operation, or the operation I do, vaginoplasty, had been done for about 30 years, 40 years by that stage. And the man who was doing it there was going to retire, and they decided they'd like me to take over, broadly speaking. And so I was asked. And after quite a long amount of consideration, I said, yes, I'll come and do that. What is a vaginoplasty? It's the surgical construction of a vagina, and that would be for a trans woman who starts with male anatomy, in other words, penis, testicles, scrotum, or it could equally be for a girl who is born without a vagina, such as a patient with androgen insensitivity, or a patient whose congenital absence of vagina, the so-called Mayer-Rokitansky syndrome. So this says step by step, how do you do it? Well, it would take me a long time to go through the whole thing in detail. But if I'm making a vagina in somebody who has male anatomy, I make a space between the rectum and the prostate, and I line that with skin, usually from the penis. Shorten the urethra, which is the tube you pee through. Bring it out, we expect to find a female urethra. Make labia out of the remaining skin. Oh, and use part of the sensitive tip of the penis to make a clitoris. In a nutshell, that's what the operation involves. What is gender reassignment? It's a term that shouldn't be used because you're not reassigning anything. These people have a gender. They were probably born with their gender identity that they feel strongly. I'm not reassigning anything. I'm just helping them live with their experienced gender. The problem is, unfortunately, it is in law. It's in the Equalities Act 2010. So the term is with us, but it's probably not a term we should be using. What is the cost of surgery if not covered on the NHS? You probably need to speak to my private secretary. In this country where I work, I think it's a package price of 23,000. It does vary between different providers, but there's only actually 4 of us working at the moment, so not very much variation. If you go to Thailand, it is quite a lot cheaper for the actual operation, but you do have the cost of getting to Thailand, and they like you to stay in a hotel in Thailand or in Bangkok probably for 6 weeks after the operation, so it does come up a bit. So it varies quite a lot worldwide, but in this country about 23,000. What is the process? Can anyone have surgery? If you genuinely identify as trans, you would need to go in the first instance to see your GP, and you're just hoping your GP is going to be sympathetic, because quite a lot of them aren't. Quite a lot of them don't believe in this and will try and talk you out of it or straightforwardly refuse to help. But if your GP will engage with you on this, the next thing they should do is send you to a specialist in gender identity. If you are going on the NHS, this means being referred to a gender identity clinic. And there is currently a minimum 4-year wait for an NHS gender identity clinic. We've got the longest waiting lists around, I think. If you can afford to put your hand in your pocket and go privately, you can see a gender identity specialist a lot faster. You then need to spend at least 1 year in your experienced gender. So if you started life assigned male and you actually have a female gender identity, you'd have to live as a woman and demonstrate that you've done so. You change your bank account details, change your passport, change your driving license, change your name. All of these things have to be done. And the other thing, of course, is that if you want to have surgery, you have to be taking hormones of the gender that you're transitioning to. And you have to have been doing that for ideally a year and have been on stable levels. And in case of the trans women, your testosterone has to be at female level as well for a demonstrable period before the operation. So no, not everybody can have surgery. If you can get through that lot and you genuinely are trans, you can have an operation. How long do the surgeries take? I do a vaginoplasty in about 2 hours. There's quite a lot of variation between surgeons because different surgeons operate at different speeds, and it's remarkable how it's set for one surgeon. You can almost set your stop clock by a particular surgeon who does an operation frequently and know that's when he'll be finishing or she'll be finishing. How is the mental health of surgeons? How do you switch off? Oh, I can only speak for myself, I suppose. Switch off. I don't think I ever completely switch off. I lose a lot of sleep if I'm doing something a little unusual the day after. I'll be lying awake thinking about the steps of the operation I'm going to do. If there's a patient where the operation hasn't gone very well, I'll be worried about whether they're going to get complications. If they do get complications, I'm worrying about them. Do I ever switch off? No, I don't. And that's probably a problem. Complete relaxation is quite difficult to get to. I probably achieve it when I go on holiday, and it's one of the reasons I say to my wife, look, if I were going to go away, I'd like to go intercontinental because there's absolutely no way I can come back. If I just go over to the Loire Valley and so I hear there's a problem, I might think, oh, I could just nip back for 24 hours. And that's really not switching off. Do you think it's morally right to perform this type of surgery? I was waiting for this question. It always comes up. Of course it is. These are patients who experience an immense level of distress. If you don't operate on them, we think about 1 in 5 will commit suicide. Well, don't operate on them. If you don't offer them appropriate support, counselling, and in the end surgery. So the death rate's about the same as anorexia nervosa. Are we going to stop treating anorexics? Don't think so. So yes, I do think it's morally right. And if you're worried about the money, that takes care of itself. Somebody did a study some years ago which demonstrated that these patients, after their operations, move significantly up the socioeconomic scale, and then they carried the calculations forward and demonstrated they actually paid for their operations as a group in increased tax revenues. So they're not taking money away from everything else, they're actually paying. Oh, there's about 3 questions in this. What is the aftercare process like, and what are the main challenges patients experience whilst transitioning? Let's turn that backwards. Challenges during transition. Okay. The patients I deal with are trans women, so they start out with male anatomy, but they have a female gender identity. Suddenly announcing that you're going to be a woman is pretty tough. And actually going out and doing it, dressing in female clothes, yes, you can get away with wearing jeans and a t-shirt up to a point. There is something between their ears that is driving them. They have to do this. But it really is a huge challenge. They get problems sometimes with discrimination. I've had at least one patient who's been murdered by a partner who didn't really like what she was doing. They get problems. Some of them fall out with their families, fall out with their friends. They have a really tough time. It's not something you can do easily. And by the time they get to me, they've got through the worst of that. And that's probably the more important part of this particular card, the aftercare process. Well, I make a vagina, they have to dilate it, broadly speaking, and they have to do that for the rest of their lives at intervals, and we give them plastic dilators to push inside the vagina at decreasing intervals. But that's the easy bit. Oh, it's a good one. What do you think about giving teenagers hormones? It worries me. I mean, I'm not actually involved in giving hormone therapy. But I do worry about giving hormones to teenagers on medical grounds. If you are looking at before you're born, you get a big dose of your sex hormone, depending what sex fetus you are. So if you're going to be born with male genitalia as a boy, you will have a large dose of testosterone in utero before you're born, and vice versa. As a girl, you'll have lots of estrogen floating around. And then after birth, that drops away to virtually zero in both sexes until puberty. And at puberty, of course, you start getting a vast mass of these hormones floating around. And what worries me about giving teenagers hormones in particular is you are actually stopping that secondary surge of sex hormone. Are we actually preventing some of them getting the brain development would actually make them happy in their birth gender? Because if they stay in the gender they are, they're going to be sterilised, they're going to have operations, and it's probably best to avoid both of those things if you can. How do you create a penis? I don't. I do operations on trans women. There are other surgeons who do operations on trans men. There are various ways of making a penis, from using a slightly large clitoris, and the clitoris grows with testosterone therapy. If it's grown to a reasonable size, you can create a very small penis using just the clitoris, to various types of skin flaps which can produce a phallus. Some of those you can then make another skin tube, which means that they can pee through the end of the phallus. You can put in erectile devices to give them erections on demand. It depends what people want to do with the penis. And that's not necessarily, I mean, it's people have one not because they want it for sex necessarily. It's the same as my trans women don't have the operation for sexual reasons. They have it because they want to feel the right person. Do you have an opinion on trans athletes as a medical expert? Well, I'm not a medical expert on athletes, I suppose, but it's a difficult one. I mean, I think starting from the premise that I think it is good for people to participate in sport. I think there have to be opportunities for everybody to participate in sport. It gets difficult when you're dealing particularly with trans women, because these people have been through a male puberty usually, have the longer levers and physical advantages of that size. And I think the problem really doesn't come down to amateur sport. I think amateur sport is fine, because we, as amateur sport, and I play, we all play within our own levels and we find our own teams that we can fit into. But it's when the money comes into it, of course. And nowadays there's phenomenal quantities of money in sport. And it doesn't seem entirely fair that elite sport you have people who have this advantage. So I don't know quite where it is. I think probably the answer is people seem to be stumbling towards the answer being there being an open category in elite sport and then a women's category. And that's probably where I think we're going to end up. And I think that's probably at the moment the fairest way I can think of it working. But it actually affects a very small number of people. And yeah, for the vast majority of people who participate in amateur sport, I mean, you want to go running, you go running. Yes, if you're a woman and you're beaten by an amazing athlete who's actually a trans woman, that might hurt a bit. But actually, the top class marathon runners, for example, they're beating most of the men anyway. The women are beating most of the men anyway. So it's less of a problem than I think it might be perceived as. Do you get nervous? Yes. And I think the day when I'm about to start an operation and I'm not worried slightly that it might go wrong is the day I should stop. Yes, I do get nervous about every single operation I do. I think I need to. Do vaginas have sensations? Can people have orgasms? Good question, I suppose. I assume you mean by do the vaginas I make have sensation, because the vaginas that people are born with actually probably don't. Once you get about 1 centimetre inside the vagina, they're fairly insensate. The vaginas I create probably have more sensation than that because they're made from skin, and the skin usually has sensory nerves, quite a lot of which will have some erogenous sensation. We sometimes use some scrotal skin as well as penile skin in the vagina, and both of those will have nerves going into them. If the nerves survive, the patients will have sensation in their vaginal canal right the way up to the top, which is more than most. Do they have orgasms? When we looked at it, 75% of our patients had reached orgasm within 3 months of the operation, so yes. What's the hardest part of your job? I suppose complications. In a perfect world, I'd do 150, 200 vaginoplasties a year and get not a single complication, but the only surgeon who doesn't get complications is the one who's retired. So yes, I find that patients who have complications, particularly serious ones, weigh on my mind. And actually that's probably what I found the hardest thing. The physical doing the operation is easy. In your opinion, what age is fair for surgery? The guidelines say not before the age of 18 anyway, so that's fine. And I'm comfortable with that. I actually have to say personally I feel comfortable if patients are a little older than 18 to 20. Because I know from my own personal experience and from watching my kids that you change a lot between 18 and 30 even. Your decision making may not be perfect when you're very young. On the other hand, on the other side of that is the longer you stay the more difficult it may be to undergo surgery later on and still pass in your gender. You may continue, for example, if you're not taking hormones, you may continue to grow facial or develop facial hair and all these things. You may, if you're assigned female, you may continue to grow breasts. Having periods if you think you're a boy must be pretty tough. So, what age is fair for surgery? Over 18. What happens to the penises? Where do they go? Into the incinerator. How much does quality of life improve post-surgery? Dramatically. I can't quantify it, but patients literally change overnight. They can be completely different people. They report back immensely increased levels of satisfaction and happiness with their lives. It's huge, amazing change. How does it work female to male? In terms of the operation, I haven't got any personal exact experience, but you've got to look at what the trans men want. Curiously enough, genital surgery is slightly lower on their wish list in most of the patients. Most of them will seek breast reduction or breast removal because it's very uncomfortable squashing a pair of even sort of A and B cut breasts to fit inside male clothing. The trans men, they have a higher uptake of chest surgery because they want those removed because that's a big external marker. In terms of making genital surgery, it's called phalloplasty, and there are various ways of making a penis which may or may not be functional for sex, may or may not be able to pass urine through it, depending on what the patient wants, and the wish list on them is different. It's not what people necessarily expect. How painful is it? Meaning, how painful is it to have a vaginoplasty, I presume? It doesn't hurt me too much, so I do get backache after a couple of them. Surprisingly less painful than everybody expects. Most of our patients have a type of epidural injection during the operation. And the majority of those where it works nicely don't use any morphine overnight. We take the morphine away from them the following day and they take ibuprofen, so Nurofen and paracetamol, and that's usually enough for them. There's one or two who need a bit more than that, but the majority of them, it's remarkably less painful than you'd expect. How do you deal with ignorant people who don't understand what you do? Well, it depends whether they're prepared to listen to me. If they're prepared to engage in a proper conversation and listen to what I have to say and try to understand what this whole business of being trans is about, approaching these patients with a bit of compassion and understanding rather than their own judgmental views on the subject, I'm prepared to have a talk with them. If they just want to shout at me about how it's all wrong and this should never be done and you've got to protect women's spaces and what am I doing, well, frankly, I can't have a conversation with these people. What's your opinion on JK Rowling? I haven't read her books. I'm not going to try and write a children's book tomorrow. I'd rather wish she'd stick out of what I do and not comment on stuff that she doesn't know much about either. She's entitled to an opinion, but why she gets quoted, it seems slightly unfair to use her privileged position to make, I think, somewhat ill-informed comment about this patient group. Are other cultures more accepting of trans people? Absolutely. In some ways you can argue that the whole trans thing and so on is a bit of a construct of modern society or societies with the sort of biblical religions and boy meets girl, have child, child meets other, and so on and so forth. And that there's only this fixed thing where you have a fixed gender and that's the way you behave. And other cultures actually have a much more sympathetic approach. Classical example would be the islands of Fiji, Tonga and Samoa, where you have a bunch of children who are born as boys, who dress in girls' clothing, who do girl things around the village, grow up and do the women's things around the village dressed in women's clothing. They're called Fa'afafine. They have a high status in Fiji and Samoa and Tonga. They're regarded as perfectly normal, quite acceptable. They almost never get married, they don't have sex, they don't have children, but that's their choice. They are welcomed, not just accepted. So yes, there are other cultures which are much more accepting than we are. The good thing is that I do feel over my career that the number of people who disapprove of gender is decreasing. In this country at least. The opinions of my children and their friends and so on and so forth are far less, I would say, bigoted than my own cohort going through. So I think it's changing, but other cultures more accepting? Absolutely. Who is your oldest patient? I can't answer that question. I can tell you the oldest patient I operated on, did a vaginoplasty for, was 85. Have you ever failed a surgery? Depends what you mean by failed. I've got some results which I've not been happy with, and the patients may not have been happy with either. I've had some nasty complications. In terms of how I ever failed to do the operation completely, the answer is no. How has your work changed your view on gender? I don't suppose it has, really. I've got more understanding of what being trans is about, but I always knew it existed. And I wouldn't have gone into it if I didn't think it was something that I was happy to support and be involved with. So I think it's really changed my view on gender. I've just got more understanding.
And as I knocked on the door and I said, "Hello, are you okay? Ambulance service?" the patient jumped out and stabbed me twice in the chest. Once here with a small knife and once right here with an 8-inch blade.